We are about to begin today's session. Welcome to this special AST Joint COP webinar being hosted by the Transplant Pharmacy, Women's Health, and Psychosocial and Ethics Community of Practice. In a moment, I will turn the discussion over to our speakers. But first, we have a few housekeeping notes to help you engage with today's discussion. There is currently a viewer poll question displayed for the audience. Please take a moment to answer this question while we finish the remaining announcements. Please note that your lines have all been muted so that only the presenters can be heard for the recording. If you have a question during the Journal Club, please use the Questions tab in the GoToWebinar panel. You can find this tab near the bottom of your panel. If there are any questions we do not have time for, we will either answer them individually offline or we will post the full questions and answers on the website following the Journal Club. Please be aware that if you click the X icon in the upper right of the main GoToWebinar panel, you will close and exit the webinar. The discussion is being recorded and the archive will be available early next week. Finally, when you log off at the conclusion of today's webinar, you will see a short survey to complete. We will use information from this survey to help us keep our content current and engaging. I will now turn it over to Alison Eisenhart to begin our presentation.
Thank you, Anne. Happy July, everyone. On behalf of the Psychosocial and Ethics, Pharmacy, and Women's Health Communities of Practice, thank you so much for registering for today's webinar. We are so excited to be bringing this to you today. We certainly hope that you find the content timely, as we've all faced unprecedented challenges in the last few months that have really affected all aspects of our lives. Just to give you a little bit of background, the discussion around today's webinar started over a year ago during a brainstorming session in a pharmacy work group. The initial plan revolved around a lecture series for new and seasoned practitioners looking at topics like work-life balance, financial goals and retirement, exercise, and mindfulness. More recently, we've collaborated with other COPs, and additional suggestions like contract negotiations, navigating burnout, and pregnancy and infertility were pitched as possible topic ideas. I mention this to you because we want your feedback. If a series of lifestyle webinars is of interest, or if you have a topic to pitch or even present, please let us know in the survey that Anne mentioned. Like I said, we are so happy to present Calm Amidst Chaos today, managing stress and anxiety during times of uncertainty. We are privileged to have with us today Dr. Heather Bruschwein and Dr. Rebecca Castner. Dr. Bruschwein is a licensed clinical psychologist and assistant professor in the Department of Psychiatry and Neurobehavioral Sciences at the University of Virginia School of Medicine. She is also a member at large for the Psychosocial and Ethics COP. Prior to working at UVA, Heather completed a 2-year fellowship in transplant psychology at the University of North Carolina in Chapel Hill. She works primarily with kidney, liver, and lung transplant patients and has a strong interest in mental health and transplants, especially anxiety and depression. Dr. Castner is a clinical faculty member at Roosevelt University College of Pharmacy and practices ambulatory care pharmacy within a family medicine clinic at Rush University Medical Center in Chicago, Illinois. She was introduced to mindfulness as a burned-out PGY1 pharmacy resident in 2010 and has been practicing ever since. In October of last year, she earned her Level 1 Mindfulness Teacher certification through the rigorous teacher training program at the Brown University Center for Mindfulness. She is eager to share her practice to help others manage stress, reduce burnout, and build a more compassionate pharmacy workforce. And without further ado, I'd like to turn things over to Dr. Bruschwein to get us started.
Hi, everybody. Thank you, Alison, for that introduction. As she said, I'm a psychologist at the University of Virginia, and I work with the transplant teams there. And I am very happy to be part of this webinar today. I do think that this is a very timely topic for us today. Next slide, please, Alison. I have no disclosures. And this is a general outline of what I'm going to talk about for my portion of today's webinar. We'll talk a little bit about some general things regarding anxiety, stress, anxiety disorders, and burnout. And then, of course, our current situation in the US, which is quite unprecedented, and how COVID-19 and protests, how they impact anxiety and stress. I'll wrap up with some general coping recommendations and resources, and then Rebecca will do the rest of the webinar. Next slide, please. So anxiety and stress, they are often used interchangeably. You'll hear people say like, oh, I'm really anxious, oh, I'm stressed out. And there's a lot of definitions of what they mean. You can see there I put two different descriptions for anxiety, one from the American Psychological Association and one from the American Psychiatric Association. So the two APAs, this was some of the descriptions that they used for anxiety. You can see that there's emotional, cognitive, and physical components of it. And that anxiety can be described as having a normal reaction to stress. Stress is a response to a situation. Usually it's an external situation and we are reacting to it, although there can be internal triggers of stress. If you have an illness or something like that, it's an internal trigger. We can have physical symptoms as a response to stress, feeling tired, having muscle tension, pain, perhaps it's affecting our sleep, causing GI issues. And there's also cognitive or emotional symptoms that we might experience when we're under a lot of stress. You've maybe noticed when there's a lot of stress going on, you lose your temper faster, it's harder to focus. And but however, stress is not always related to a negative event. It can be related to positive events. Weddings, the birth of a child, those are very happy events, but there can be stress related to them. And with stress, when the situation or the stressor is removed, our stress goes away. So it's not something that continues after the stressor is removed. And while stress and anxiety typically we think of as negative, they have found that moderate amounts of it can be okay and even motivating or helpful. They find that if people have lower level, like some low level of stress or anxiety, it can help us be productive at work, it can help us focus, and it can help us to be more productive than we might without it. Next slide, please. So how does this differ from an actual anxiety disorder? Because people do say a lot like, oh, I'm stressed out, I'm worried. But when you have an actual anxiety disorder, that's when the anxiety or the worry or the stress that you feel, it starts to become out of proportion to the situation. And you'll find that it starts to interfere with your ability to function, whether that's at work, in your relationships, with your family. And an anxiety disorder will persist over time. It might have a trigger, but it will continue even after the trigger or the stress goes away. So if, unlike just experiencing stress, you know, if you're stressed out about a project, when you finish that project, it goes away. If you have an anxiety disorder, when that stressor goes away, you're going to continue to feel anxious even in the absence of the stressor. You will probably experience a lot of recurring anxious thoughts. If you have an anxiety disorder, you might start to avoid situations that cause you to feel anxious. An example would be people who have social anxiety start to avoid social situations because it causes them to feel anxious. There's a number of physical symptoms, quite similar to, to being under stress. There's physical symptoms like shaking, sweating, increased heart rate. And an anxiety disorder can happen in the absence of a stressor, but it can also occur as a response to stress, and it can also cause stress. So you can see there's a lot of interplay between all of these variables, but the biggest difference is that when it turns into an anxiety disorder, it starts to really impact your functioning and your mood, and it persists over time. Whereas just feeling anxious or having stress, that's not necessarily going to happen. Next slide, please. So here is the DSM-5 diagnostic criteria for generalized anxiety disorder. You can see in category A there that anxiety and worry has to be excessive and occur for more days than not for at least 6 months. So there's that persistent time piece. And if you find it difficult to control the worry. And then in section C there, that's a list of some of the different symptoms that you would notice. And then D is that component I was just talking about, where the worry and the symptoms, they cause clinically significant distress or impairment in areas of your life. Next slide, please. For prevalence of anxiety disorders, they are quite common disorders in the US. The National Institute of Mental Health has done quite a bit of research about prevalence. They found that about 20% of adults in the US will have had some type of anxiety disorder in the past year. And you can see on the slide there that they listed all of the different types of anxiety disorders that are included in that 20%. Anxiety disorders are more common in females than males, so around 23% of females versus 14% of males have some type of anxiety disorder. And they found that about 30% of adults in the US will experience an anxiety disorder at some point in time in their life. And of all of the anxiety disorders, generalized anxiety disorder is one of the most common ones, and that's the criteria that we looked at on the slide previously. Next slide, please. So we talked a little bit about stress and anxiety. I would like to mention about burnout in healthcare, which can be caused by stress. Burnout is a very significant topic in healthcare, even before the current COVID-19 situation. It was receiving a lot of attention, as it should, because it's found across professions in healthcare. There was a number of studies that got some attention about up to 50% of physicians experience burnout at any given time. But there's also research showing that burnout rates are very high in pharmacists as well, 55 to 64% in pharmacists. So it's significant in all professions in healthcare. It's caused by prolonged work-related stress, and people experiencing burnout might notice emotional exhaustion, depersonalization, low sense of personal accomplishments. And the risk factors for burnout, you can see there: high workloads, high patient-staff ratios, high pressure situations, and then moral distress. And moral distress is when you have to make a clinical decision that's not consistent with your values as a provider. It's like knowing the right thing that you want to do, but being unable to do it because of the situation. Examples of this with COVID-19 and some of the resource scarcity, there were teams or healthcare workers that had to decide, if there weren't enough ventilators, what patients receive the ventilators and which ones don't. Our values as providers is that, any patient that needs one, we would want them to have. In some situations, not everybody could have that, and that's very, very distressing and causes moral distress. So that's another risk factor for burnout. And then at the bottom of the slide for consequences of burnout, patient satisfaction is lower, there's poor outcomes, medical errors, turnover, and for the person experiencing the burnout, lower quality of life and mental health problems. Next slide, please. So now that we have talked about anxiety, stress, burnout, wanted to give everybody a background there. Now let's look at it in the context of our current situation. As was mentioned at the beginning of the webinar, this is a very stressful time for our country. There's a lot of very significantly stressful things happening in our country and around the world as well. COVID-19, the protests, and the political tension. There's just a lot going on, and it is very, very normal to experience anxiety or stress because of it. And I think especially for us in the field of healthcare during a pandemic, these are very stressful times, and it is very normal to feel anxiety or stress. So I definitely want to emphasize that it is normal to experience anxiety or stress in this situation. Next slide, please. So let's take a look at a study of the impact of COVID-19 on mental health. This study was one of the first that they conducted with healthcare workers in Wuhan, who were, some of the first healthcare workers to work with patients. At the bottom of the slide there are descriptions of the screeners that they used for this study. So they used a depression screener, an anxiety screener, an insomnia screener, and then an impact of scale screener. So using those, they found that about 30% of the medical staff did not have any significant symptoms on those screeners. About 34% had mild, about 22% had moderate symptoms, and then 6% had severe symptoms. So in the healthcare workers who were working with COVID patients in Wuhan, there was a majority of them had at least mild symptoms on the screeners. Next slide, please. All right, so some of the risk factors for healthcare workers during a public health emergency such as this, access to PPE, that's been something that's been a pretty hot topic in the news. The risk of exposure that we take if we do work with those patients, the gowning process, the impact on family life, the potential to be redeployed or reassigned to another unit, and then communication, stigma, and then also there's an increased risk of moral distress in this situation. As you can see, we mentioned this earlier in that example of the ventilators. And then they've also found by looking at past epidemics that there were higher levels of burnout during those situations. So it's definitely a lot of risks that healthcare workers are experiencing right now. In terms of stress across the country, the American Psychological Association, they do a yearly survey on stress in our country, and with COVID-19, they adapted their survey to fit the situation. And they found when they did their survey that our average level of stress related to COVID-19 is higher than any stress score that they ever found in previous surveys, which makes sense that our country is experiencing the more stress now than we have since the survey started, which was in 2007. And so they asked people on a scale of 1 to 10 to rate their stress. Last year, 4.9 was the average score. This year was 5.9. But parents reported even higher levels of stress than adults without children, and their average score was 6.7. You can see there the list of some of the stressors that parents reported as being stressed about. And for all adults, parents included, 67% reported that government response to COVID-19 was a significant source of stress. This was found across party lines, regardless of your political affiliation. And then other stressors were economy, work, and then the survey found that people of color were more likely to report higher stress. Next slide, please. They did a second version of the survey after the death of George Floyd and the protests started. And so the APA found in that survey of US adults that 83% felt that the future of our nation was a significant stressor. 72% felt that this is the lowest point in our nation's history that they could remember. Police Police violence, COVID-19, and the government response were all significant stressors reported by the survey. I did want to include that 67% felt that the current movement against systemic racism and police brutality, they felt that it would lead to meaningful change. So I did think that that was a hopeful piece, that people are hopeful in general that this current situation will lead to improvement. And then parents continued to report high stress and concern about the impact of the pandemic, and over half of parents reporting that their children were acting out more than in the past. Next slide, please. One more survey to look at. The US Census Bureau started a survey that they originally started it to look at COVID-19, but then with the protests and everything, then they adapted their survey as well to study that in US adults. And they found that among Black and Asian Americans, there was increased symptoms of depression and anxiety, with police brutality towards Blacks being a factor in the increase in symptoms, and then for Asian Americans, that they experienced discrimination, harassment, and hate crimes, particularly in the beginning of the pandemic. And their survey found that overall, adults reporting symptoms of depression and anxiety more than tripled since a version of the study that they had done in 2019. Next slide, please. In terms of impact of protests on mental health, there was a literature review done on a number of different studies looking at this. They found that there's an increase by 7% of probable major depression after a major protest. You can see there a list of risk factors for experiencing poor mental health. And some of the studies found that even nonviolent protests could be associated with adverse mental health outcomes. For a positive note, there were 2 studies that found that collective action, such as a protest, might reduce depression and suicide, and they hypothesized that that could be due to people finding the protest to be a cathartic experience, or that it increased social cohesion and brought people together. Next slide, please. So to wrap up my portion, a few general recommendations. As you know, we've talked about anxiety and stress. It can be motivating. It's not necessarily a negative thing, but we do need to keep an eye on it and try to take care of ourselves during this very stressful time in our country. You know, the good news is there's a lot of different ways to cope with stress and anxiety, and can be very beneficial. Some general recommendations to keep an eye on yourself, and we know ourselves best. So are you starting to have sleep difficulties, feeling overly tired, losing your patience quickly, feeling anxious? Keep an eye on yourself and know when you might start to experience some of these. Try to encourage social support among you and your coworkers. With many of us working from home or not having the same type of group dynamics that we had, we might have to be creative with how you spend time with your colleagues and encourage social support. Next slide. I think it can be very easy to overlook things that we all know are good for ourselves when we're under stress. Trying to make sure that you engage in healthy activities, aerobic exercise, making sure you're eating well, getting enough sleep, that you're spending time with family and friends. If you are socially distancing or isolating at home, video calls, things like that. And even if you're unable to engage in all of the activities that you enjoy, trying to focus on making sure that you're doing things that you value, fun, relaxing activities, or things that give you a sense of accomplishment. There's a lot of people working from home right now, and it can be kind of tricky to integrate your work and your life when maybe your work is taking place at your kitchen table. And so part of it is just acknowledging that you might not be able to be as efficient if you're working from home. And it can help to identify 1 to 3 of the most important things you want to get done that day, focus on them, and then look at the end of the day, review the things that you've accomplished so that you can try to foster a sense of accomplishment. Try to have a schedule, and to keep that schedule consistent throughout the week. Make sure you're getting breaks, and then especially if you're working from home, having an identified transition where you can say, all right, I'm no longer working, and now I'm just at home, even if you're out, maybe you're in the same room during that, but having identified transitions. Next slide. And another thing is to focus on what you can control rather than what you can't. Anxiety and stress can be exacerbated by feeling a loss of control or helplessness. And there's a lot of things that we cannot control right now. And so instead, focusing on the things that we can. There's a coronavirus anxiety workbook that's listed there on the bottom, and they have a lot of great ideas of things that can help. Next slide. For parents, acknowledging that you are not going to be perfect as a parent during this time. There's a concept of good enough parenting, and how can you create traditions for your family, have routines, how can you incorporate exercise and other like healthy activities into your family, and reaching out when you need it for support from other parents. And then the last thing, which my co-presenter Rebecca is going to present on in just a minute, so I just wanted to put in a note to lead into hers, is that relaxation and mindfulness can be very helpful. And even taking a minute to do mindful breathing when you are doing routine things such as getting out of the car, walking into work. A lot of times people are just on their phones when they're walking around, but instead if you take that time to just try to focus and be mindful of your breathing, that can be very helpful. Next slide. Here is a list of other resources, and I'm not sure if they're going to have these slides available. I know this is being recorded, but here's a list of very helpful resources that I've been using with my patients. There's resources on here for kids, families, adults, providers, and these are all COVID-19 coping resources since they've been out for quite a while and I've been using them, but there's also a lot of book lists online or ways for people to take action regarding the protests and things like that. So consider looking into those as well. Next slide. So in summary of my portion, we looked at anxiety and stress, anxiety disorders, burnout, and then the impact of COVID-19 and the protests on the current state of anxiety and stress in the US, and then some list of general coping recommendations. The next 2 slides are my references, so we can just kind of skim through those, and then I would like to hand it off to Rebecca, who will now talk about mindfulness.
Great, thank you so much, Heather. So thank you all so much for joining us today. I'm so excited to talk to you all about mindfulness. Just as far as conflict of interest, I will not be quitting my day job anytime soon. I definitely don't have any conflicts. Mindfulness is not very lucrative, but it is very helpful. So I am really excited to share it with you all today. Next slide. So starting off with some objectives, by the end of the session, I'm hoping all of you will be able to define mindfulness. You'll be able to recognize the effects of mindfulness on the stress response, and finally identify potential risks and benefits of various mindfulness practices. Next slide. As far as my outline today, so we'll review what mindfulness is and definitely also what it isn't. We'll review how mindfulness can actually benefit our patients as we practice. We will go over the role of mindfulness in bias reduction and habit formation, mindfulness impact on the stress response, risks and benefits of mindfulness practices in general, and then hopefully with some time left over, we'll do a practice together. Next slide. So starting off with what mindfulness is. So many of you probably heard of Jon Kabat-Zinn. He's the creator of the mindfulness-based stress reduction program that was created in the 1970s and is considered the gold standard in mindfulness. He defines mindfulness as awareness that arises through paying attention on purpose in the present moment non-judgmentally. And each one of those elements is key to mindfulness. You can't have a full mindfulness picture with any of those missing. That being said, we are human beings and we're not perfect and we're wired to judge and ruminate. And so this is not a practice of perfection, it's a practice of a practice. So, you know, the reason why we practice, just like if we were playing sports, we practice so that we can perform better in real life. The same thing for mindfulness. We practice mindfulness so that when stressful times arise, we can deal with them better. So as far as MBSR specifically, we talk a lot about beginner's mind and approaching essentially every experience in life, if we can, with the intention of this sort of childlike curiosity. So if I didn't have my pre-existing notions, or if I didn't have this history of this situation, how would I approach this situation? What would I learn? So if you, you know, watch a baby just looking around, a newborn baby, it's, you know, you can see in their eyes just the wonder and awe of what's happening and just taking everything in. And that's really what the beginner's mind is all about. The intention is to, in that way, become an objective observer. So because we're not clouded with these past experiences, we can see the world more for what it really is than what our perception of the world is. Some teachers of mindfulness will refer to this as getting out of the virtual reality of our own mind and living in actual reality. So the more we can live objectively with what is in front of us, the more mindful we are, and potentially the more reduction in bias we can have over the long term. Next slide. What mindfulness is not, there are many things that it's not that have been promoted. Many of you might have heard people talk about McMindfulness. There was sort of a mindfulness explosion a few years ago. We started hearing everybody talk about it. Silicon Valley was using it as a productivity technique. And there were a lot of misconceptions that came out about that. So I always try and like to clarify what it is not, even more so than what it is. So it's not meant to be a method of increasing productivity. We do see that there's an increase in the ability to pay attention when we practice mindfulness. The important thing, though, here is that when we practice mindfulness, we typically are interested in reducing stress. And what will happen if we're not using it in those terms and instead we're using it as a productivity tool is we will be getting more done, but instead of taking the time that we would have had and relaxing with that extra time, we end up piling more on our plate. So it's really important to make sure that we keep an eye on our stress through mindfulness, and we're not actually increasing things and putting them onto our plate so that our stress remains at baseline when we're actually making a lot of headway and a lot of improvements in the way we address these things. It's not sitting on a cushion chanting Om. There's definitely a formal component of sitting meditation in a lot of practices, but this actually isn't necessarily even done sitting. We call it sitting meditation, but it can be done standing, it can be done lying down. We'll not get into all of those specific elements today, but I'm happy to talk to you know, after the session or offline with any of those questions. But you know, that typical sort of vision that has been put in our minds of a person sitting on a cushion, while it can be a component of mindfulness, it's not necessarily the whole spectrum or even the whole practice that one person will use. And it's actually typically better to use multiple practices. It's not a cure-all for mental illness or distress. It can actually be very helpful for a lot of psychiatric disorders, but we really need to be cautious to ensure safety in patients. And I'll talk a little bit about the risks of mindfulness a bit later. It's not a religion, so it does have Buddhist origins. Buddhist monks are credited with bringing mindfulness to practice for other groups of people as well. But the practice in and of itself is foundationally secular. We don't need to believe in a certain God. Our God, if we do believe in one, does not inhibit us from being able to be mindful. And it's also, and this is probably one of the most important things to know, it's not a way to make everything in life pleasant. So mindfulness will not in and of itself make the world more pleasant or less pleasant. Everyday life will always be a mix. And what mindfulness actually teaches us is that our desire to change things into something that they're not in life is actually a lot of our struggle. Practice does foster, however, equanimity. So equanimity is defined as an even-minded mental state or dispositional tendency towards all experiences or objects, regardless of their effective valence. So regardless of whether something is pleasant, unpleasant, or neutral, being able to be with that moment and being able to sit with our emotions and still be able to sit with them objectively. There's a common misconception that equanimity is the same thing as indifference. So if you become super mindful, that means you have to accept everything as it is, and that you have to sort of say, well, you know, this is an unpleasant thing, but you know, I'm just going to accept it. That's absolutely not the case. What mindfulness does is it allows us to recognize those situations where things are maybe unpleasant and change either our approach in life or change our actions, so that we're able to approach those situations in a way that reduces suffering for us and also allows us to potentially even change habits based on that recognition. Some contemplative scientists are actually starting to use equanimity as a primary outcome in studies. So in the past, there's been a lot of sort of secondary endpoints, things like stress reduction, things like just mindfulness scales in general, and we're finding that equanimity actually could potentially be the most true gauge of how mindful someone is. Next slide. So what are mindfulness practices? So for MBSR, so our gold standard category, there's two basic categories. There's formal practice and informal practice. So formal being those sitting meditation activities that I mentioned, also gentle hatha yoga and body scans, whereas informal is mindful activities in daily life. So those are things that Heather mentioned, things like stepping out of the car and paying attention to how the road feels when our foot hits it. Those kinds of just, you know, picking out a specific activity during the day. Hand washing is another great one, especially for healthcare providers. Really just paying attention to what the water feels like, how our hands feel rubbing against each other, what that soap looks, feels, sounds, smells like, all of those things. The field, however, since MBSR was created, has expanded widely, and I wouldn't even necessarily say that it expanded from there, because these exercises have been around since ancient times. So we actually, when we talk about Buddhist monks that were the first practitioners of mindfulness, we refer to them often as the ancient psychologists, because really that's what they were doing. They were examining emotions, examining the stress response, and understanding how those things played into daily life. So other aspects are grounding exercises. So these are basically exercises that help us bring ourselves back into our body when we're kind of all up in our head. Feeling into the feet is a very common one, because they don't usually hold anxiety, whereas things like, you know, behind our shoulder blades or in our chest, that sometimes gets tight with anxiety, whereas the feet are more neutral. Breathing exercises. So 4-7-8 breathing is my very favorite one. If you ever Google that, it's a great activity, but there are various breathing exercises that people do. Guided imagery in terms of different kinds of meditation. So the mountain meditation, if you're familiar with Jon Kabat-Zinn, you probably are familiar with that meditation as well. That's definitely my favorite, but there are many others as well that are helpful for guided imagery. There's anchor focused. So a lot of the time in the past, we just thought about this as awareness of breath. And what we found through sort of looking at our mindfulness practices and recognizing what trauma does in terms of how it presents itself in mindfulness practices is that we maybe should have alternate anchors for people, because not everyone has an easy time breathing. So even if the stress response isn't activated, if we're not having chest tightness or things like that, You know, there are people that have COPD or asthma or emphysema, and so that act of focusing on the breath can actually be a big struggle and can be really stressful. So finding an alternate anchor, for example, what the palm of the hand feels like resting on the leg, is something that we can use to focus on in meditation. Loving kindness meditation or self-compassion or metta refers to meditations where we are typically tapping into sensations of pleasant emotions, so love, joy, definitely compassion, and we're typically allowing ourselves to sort of give those good vibes to others as well as accept them for ourselves. And then Vipassana or insight meditation is essentially awareness of awareness. So we start typically with just awareness of different anchors, sounds, sights, different emotions, different feeling tones, and then eventually that culminates in an awareness of our awareness of those things. So a sort of metacognition of mindfulness. And there are also combinations of these. So a really great example that I think is great for sort of like the middle of the workday is if we notice ourselves finding or feeling stress in an area of the body, placing a hand on that area if possible, and basically allowing ourselves to give it compassion, if you will. So sending compassion to that area. It's kind of a both an anchoring practice as well as a self-compassion practice. And then 5-finger breathing is a combination of breathing and grounding, which I'm hoping to get to at the end of our session as well. Next slide. So why practice mindfulness? So I mentioned before, this results in reduction of bias, which leads to positive outcomes for patients. It helps to also avoid empathy fatigue and disrupts reward-based feedback loops. And it also leads to reduction in the body stress response. So this happens in a couple different ways. It can blunt the response after it's begun. It can reduce activation of the stress response and improve stress hardiness, or another word for stress hardiness is resilience. Next slide. So looking at mindful practice of medicine, so practicing with sympathy and with presence. So grounding practices and short meditations can be really helpful to reduce brain chatter and reduce errors. There's actually a pharmacist named Lisa Hanlon-Wilhelm that is a med safety pharmacist in Pennsylvania that has been doing this for years. So if you want to find out more about how to integrate that into your practice, she is definitely someone to talk to. She loves to hear from people. Also, something that I really like to point out, though, is there's this big emphasis, especially in the past few years in medical practice, on being empathetic in interactions with patients. And that kind of makes me wonder why that is. So this wasn't always a big push in medicine. And, you know, Heather talked a bit about burnout and how that depersonalization can happen. Basically, you know, treating our patients as objects as well as depersonalizing from ourselves. And so it makes me wonder, you know, is this an element of depersonalization that if we had addressed the burnout to begin with, would we really have to worry about empathy and practicing with it? So going along with that, it's really important to recognize that too much empathy actually can be really difficult and can lead to empathy fatigue and potentially burnout. So I'll refer a lot to Judson Brewer's work in the talk. So he is an addiction psychiatrist, neuroscientist, and a preeminent mindfulness researcher at Brown University. And he talks a lot about empathy fatigue and how we really should be practicing more of the sympathy if possible, because the reality is we're not going to be able to truly be in our patient's shoes. And if we only practice with empathy, that becomes really weighty and unhealthy for us. We're basically taking on everyone's problems all day, every day. If we really are truly doing what we're saying we're doing, we're being empathetic. And that's not something that should be reciprocated by patients. We shouldn't be telling them what our problems are. And so there's no way for us to really unload or come back from that in a really productive way throughout the day. So working with sympathy, it can actually be really valuable. There's also really interesting data that's emerging looking at relationships with patients that are practicing with mindful listening rather than empathy. And so what we found in some of these studies is that when people practice with empathy, we start to assume what we think the patient thinks and needs. And so this is called perspective mistaking. We might actually give a recommendation that is not ideal for that patient because we take into consideration what their problems are that they're discussing with us, and then we're thinking to ourselves, well, if I put myself in their shoes, this is what I would do and this is what I need. And they might not need those same things. So we need to make sure that we're really asking the right questions and we're really listening to their answers. And that's been shown to have better patient satisfaction and better patient relationships, even more so than empathy, and focusing on that with our patients. Next slide. So to understand how mindfulness helps us with good habits and to break bad habits, we need to understand reward-based learning. So all throughout the day, we have positive cues, negative cues, and potentially neutral cues. So our positive cues, our brain interprets as wanting more or craving them, whereas negative cues, our brain interprets as wanting to avoid, or we call it aversion. Evolution has created our brain to be judging these all the time. And our brain has gotten so good at this through evolution that it actually starts to remember and make associations. And what I mean by that is that when we encounter a negative cue, our brain actually many times not only will try and remove us from that negative cue, but will turn us towards a positive association. So a great example of this is emotional eating. So we may have had a really great slice of chocolate cake. We thought about it. It's amazing. You know, that sounds wonderful. It tastes wonderful. And so the next time we have something really bad happen, let's say we do, we have our boss is mad at us at work, we might actually not only say, oh man, I really want to get home, I want to just relax and get out of here, but we might also say, and you know what would feel really great if I had a piece of chocolate cake right now. And that's really what that association is doing. It's the reward-based learning that we're learning. We have a trigger, it leads to a behavior, which in turn causes a reward. And it's important to recognize that this process is driven by the reward itself. So this is actually also the same pathway for addiction. And so with addiction, we see people all the time saying, oh, if only I could stop drinking, or if only I could stop doing whatever XYZ behavior it is. It's not the behavior that's the thing that is really driving it. It's what they're getting out of that behavior. So if we can recognize that reward and whether it's really truly coming back over and over again, or if it's instead, as an addiction usually is, leading to a negative consequence, then that might actually stop us from wanting to perform that behavior because that reward we assume is no longer there. And so this is the impetus of reward-based learning. And what we see is that after a while with these associations that our brain makes, we start wearing these colored glasses. And so these glasses sort of shade the way that we see the world, and as such will cause us to react in a certain way without looking at things objectively anymore, because we already are making this assumption based off of past experiences and different cues that we've seen in the past. Next slide. So with mindfulness, what we actually see is sort of a removal of these glasses. We're taking an active role in trying to make sure that we're seeing things objectively. And what we see is over time, increased subjectivity leads to increased objective perception of the reward. So as I mentioned before, addiction in and of itself is basically having the same behavior that produces negative results and continuing to do it anyway. If we see that that reward is not all it's cracked up to be, as so we thought, then that craving starts to diminish many times, and we're actually seeing that in studies. We also use mindfulness to increase our ability to respond to cravings versus reacting. So taking a pause when that craving is there and saying, what does this feel like? Can I just be with this feeling and see what happens? And that pause in and of itself, we've also seen in studies that are emerging, can be enough to break that cycle. And what we end up seeing is that these habit loops that are formed based off of these, glasses that we put on, these bias glasses, using mindfulness over time because of our objective view of both the craving and especially because of the reward, we start to remove those glasses and break that loop. We talk a lot about it in terms of, Judd Brewer talks a lot about the kid with the lollipop. You can yell at the kid if they're throwing a tantrum because they want a lollipop, but that'll make the kid cry harder. You can gag the child. It's going to make them quiet for a while, but then when you take it off, it'll be even worse. You can give them the lollipop. That reinforces that behavior. That habit loop is even stronger, and they're going to throw a tantrum every single time they want a lollipop. Or you can let the kid yell themselves out. And that's essentially what mindfulness does. It allows that valence of that craving to start to reduce, and then us to be able to see things more objectively. The kid with lollipop will realize sooner or later that tantrums don't solve anything, and they're just not going to try and do it anymore. We see this actually in a really significant way in studies. There's many coming out, definitely with anxiety, with eating disorders. The one that I like to reference a lot is Judd Brewer's study on smoking cessation using this. So he did a comparative study looking at patients with standard of care smoking cessation and then just mindfulness. And so what he did is he instructed patients to just be present with their cigarettes. So don't be on social media, don't talk on their phone, don't walk around, just take in every single thing you can from that cigarette, what it tastes like, what it smells like, what it feels like on your fingers, all of these things. And what they found was that the results were really remarkable. So there were better results with the mindfulness category than the standard American Lung Association therapy to quit at the end of treatment. And there were actually more that were still abstaining at 17 weeks in the mindfulness group versus the standard of care group. We all know that smoking is bad. You know, we know that cognitively, but what that mindfulness does is that it actually allowed the patients to internalize it and really recognize how basically negative that action was. It allowed us to feel it in our bones. Next slide. And so this brings me to embodiment. So I kind of like to joke around about how this was me back in about 2010 when I was super burned out. This is a picture of Krang. If you ever watched Teenage Mutant Ninja Turtles, he was a bad guy that walked around in this this essentially person-like vehicle. And that's how I was living my life. I was living from the head up. My body was a vehicle that was kind of toking my my brain around and letting me do the things I need to do. And so we see that happening a lot with anxiety. So we see a reduction in interoception, especially in patients that have anxiety, which is the ability to sense changes in the body due to the stress response. And we actually not only see in studies coming out that happens, but that the ability to judge what that interoception is doing once we feel it is also misinterpreted. So we can think it's more damaging than it really is. Next slide. So looking at stress response activation, there's many involve an extensive focus on breath, which activates the parasympathetic nervous system. Mindfulness also focuses on short-term blunting or stopping of the stress response if they have less emotional risk. So I call these the benzos of the mindfulness world, things like grounding and breathing exercises. It basically resets our brain in and of itself for the most part, as well as activating that parasympathetic response many times. And mindfulness activities that involve long-term reduction of stress have a higher emotional risk. So it's important for us to recognize when is the appropriate time to do one kind of mindfulness activity versus the other. Next slide. When we do the long-term kinds of mindfulness activities, it can actually increase our stress at first. Facing stress is stressful. So there is no shame in focusing on the short-term solutions in current times, especially when there's such high stress. Just like if somebody had a severe form of anxiety and we were giving them a benzo bridge, it is totally appropriate to focus on methods that are short-term outcome focused and then save those sort of long-term interventions for when we're at a lower baseline stress. Again, thinking about the fact that happiness is not something that is the main outcome of this. It's being with our emotions. So, you know, it's not a magic bullet, unfortunately. Next slide. So comparing different mindfulness exercises. So I put together this chart for you that basically takes a look at, you know, what's most effective at blunting the stress response, what's begun versus preventing it from being activated overall. And then how much physical stress versus emotional stress there is. And so we can see the ones that sort of the short-term intervention, so mindful moments, grounding exercises, breathing exercises, those tend to have very good responses for blunting or stopping the stress response once it's begun, but not so good in the long term in terms of preventing it from happening in the first place. But again, with the most risk, there's where the long-term most reward is. So we want to make sure that we're doing a really good job of evaluating what's appropriate. Next slide. Looking at the physical risks and emotional risks. So physical risks are typically more associated with mindful yoga, whereas emotional risks are basically just recognition of things that we might not have been paying attention to in life, including things that we might not like about ourselves and how we deal with life, as well as potential for trauma to arise that happened in the past. So again, just making sure that we're really evaluating who is appropriate for what different kind of exercise is really important. Next slide. And so in summary, there are many different mindfulness practices available. Choosing the right practice is highly dependent on the practitioner and the situation, and integrating mindfulness into practice as pharmacists improves patient outcomes. And next slide. I have some resources here. These will be posted, so in the next 2 slides. So these are kind of my baseline resources, but there's many, many more out there. And I'm happy to give you any resources that you're looking for. And then also I'll give some recordings and videos as I'm able to that I've produced as well, so that if you're able to tap into those as well if you find them helpful. Next slide. And feel free to definitely email me if you have any other questions. I know we're running out of time. It's a big topic and I could talk about it for 5 more hours. So, you know, definitely feel free to email as well. Next slide. And just some references. And then I do want to leave a little bit of time for Q&A. So I will hold off on the 5-finger breathing exercise, but that is something that is a short-term practice that I would highly recommend anyone who's interested to check out. And I'll post a link to that as well, actually to Judd Brewer's YouTube channel, which he does a really great job of explaining what happens. And so with that, thank you so much. Next slide. And questions in the last couple of minutes for us.
Thank you, ladies. That was excellent, excellent. I definitely learned a lot, and I hope our audience did too. Currently, we have no questions. So if Anne says it's okay, we might be able to go to Rebecca's mindfulness exercise.
Okay. So this is called 5-finger breathing. I apologize if I don't have a visual for you. I was thinking that I would have my webcam up. But you can take your hand, so whatever your non-dominant hand is, and hold it up in front of you with your fingers spread, kind of like, you know, when you used to draw turkeys when you were in kindergarten and twist your fingers. You can fingers spread out like that. Hold it up in front of you, and then you're going to take your dominant hand and you're going to take the index finger of your dominant hand and close the rest of your fingers so that you're pointing. And what you're going to do is you're going to do a few things. So we're going to basically guide our pointer finger from our side of our hand at the base of our thumb, and we're going to basically trace it up the side of our thumb, over our thumb, down to the other side, then up the index finger of our non-dominant hand, over, down the other side. And we're going to do that with every finger as we go along, and then we're going to go back doing the same motion. And every time we move and trace up a finger, we breathe in, and every time we go down, we breathe out. And so what this is doing is, it's number one, as I mentioned, it's a breathing exercise, so it's activating that parasympathetic response. So breathing is really helpful because it's one of the only things in our body that we can actually effectively trigger the parasympathetic response, and it's also linked to the sympathetic response. So that's one of the main reasons why we really focus on breathing a lot. What we're also doing is we're looking visually at our hand and seeing what's happening. And then we're also not only recognizing the sensation from our pointer finger, but the sensation of our pointer finger gliding along our non-dominant hand. So all of these different visual, feel kinds of perceptions, basically what it's doing is it's crowding out the dorsolateral prefrontal cortex area of our brain that really just starts going haywire when we get super high anxiety. And it ends up resetting it because we're crowding out all of those other thoughts because we're putting so much demand on just these different perceptions that we need to process. So just starting off with the base of the thumb, and we'll just do a couple of fingers going up, breathing in, then down the thumb, breathing out, up the index finger, breathing in, breathing out, going down the index finger, up the middle finger, breathing in, breathing down. And really that's the whole exercise, is just going through that process. Typically we have it, we go through the process a couple times. And by the end of that, then our breathing has slowed, our stress response is calmed. It's also really great for kids because they think it's really fun to do with you a lot of the time, and they actually enjoy teaching other people how to do it as well. So a really great exercise for a lot of different people. And that is all. I know we're at time, so thank you so much, everyone, for joining.
Thank you again, everyone. Please remember to fill out the surveys, especially if you are interested in us continuing this as a webinar series. We are open to topics. It is nice to kind of break up some of the more sciencey, super transplant topics with something that maybe will help us balance our life a little bit more. Right now things are changing rapidly, and I think we can all use some reinforcement in outside areas of our life that'll help reinforce our clinical inpatient life as well. That being said, I'm glad that Heather and Rebecca both talked about a lot of different aspects of mindfulness and taking care of oneself. Some of you may be familiar with some of these topics and methods, but like everything else, there's different preferences for different people. And I'm especially glad that Rebecca brought up the fact that mindfulness gets thrown around a lot. And so you might have been introduced to it previously and not been able to appreciate it in its traditional form. And as we all learned today, there's lots of different ways to apply it in our lives. And with that, thank you again, and I'll turn things over to Anne.
Great. I want to thank Heather, Rebecca, and Alison. I know I learned a lot. And I want to thank the audience for joining us today. Please remember to complete the evaluation survey and visit the AST website to view the webinar recording. Thank you so much, everybody, and have a good afternoon.